Hello, and welcome back to Life of Medical. Today, we're discussing a topic that's incredibly important for cervical health, yet often a source of apprehension: colposcopy and the device used, the colposcope. If you've had an abnormal pap smear or a positive HPV test, your doctor might have recommended this procedure. It's natural to feel a bit anxious, but understanding what a colposcopy is, why it's done, and what to expect can make a huge difference. Our goal today is to demystify this vital examination and empower you with knowledge. So, let's explore the world of colposcopy together. What is a colposcope? Let's start by understanding the main tool involved. What exactly is a colposcope? A colposcope is essentially a specialized, lighted, binocular microscope that is mounted on a stand. It's designed to give your healthcare provider a highly magnified and illuminated view of your cervix, which is the lower, narrow part of your uterus that opens into the vagina. It can also be used to examine the tissues of the vagina and vulva. Think of it as a pair of super-powered binoculars that allows the doctor to see cellular details and tissue patterns that wouldn't be visible to the naked eye. The colposcope itself stays outside your body. It doesn't touch you. Its purpose is to help your doctor identify any abnormal areas on the cervical, vaginal, or vulvar surface that might require further investigation or treatment, playing a crucial role in the early detection and prevention of cervical cancer. How does a colposcope work, and how is the procedure done? Understanding the how can make the process feel more familiar. So, how does a colposcope work, and how is the colposcopy procedure generally done? The colposcope device itself, as we mentioned, provides magnification, typically ranging from about 5 to 15 times, and has a bright light source to clearly illuminate the tissues. Many modern colposcopes are also equipped with a camera, allowing the images to be viewed on a screen or even recorded for documentation. The procedure itself is usually done in your doctor's office and is quite similar to having a pap smear. You'll lie on an examination table with your feet in stirrups. Your doctor will gently insert a speculum into your vagina to hold the vaginal walls open, allowing them to see your cervix. The colposcope is then positioned near the vaginal opening, but again, it remains outside your body. Your doctor will look through the colposcope to examine the cervix. To help highlight any abnormal areas, a mild vinegar solution, called acetic acid, is usually applied to the cervix. This solution causes abnormal cells to temporarily turn white, making them easier to see. Sometimes, another solution called Lugol's iodine may be used, where normal cervical cells absorb the iodine and turn brown, while abnormal cells often don't. The entire visual examination typically takes about 10 to 15 minutes. Why is a colposcopy performed? There are clear reasons why your doctor might recommend this exam. Why is a colposcopy performed? The most common reason for a colposcopy is to further investigate an abnormal pap smear result or a positive test for high-risk types of human papillomavirus, HPV. HPV is a very common virus that can cause changes in cervical cells, and certain high-risk strains are the primary cause of cervical cancer. A colposcopy allows your doctor to take a much closer look at the cervical cells to see if these changes are present and to determine their severity. It's a diagnostic step to understand what's really going on. Specifically, the doctor is looking for signs of dysplasia, also known as cervical intraepithelial neoplasia or CIN, which are precancerous cell changes. It can also detect early signs of cervical cancer, genital warts, inflammation, cervicitis, or other benign conditions of the cervix, vagina, or vulva. The goal is early identification, which leads to more effective and often less invasive treatment if needed. Who performs a colposcopy? This procedure requires specific expertise. Who performs a colposcopy? Colposcopies are typically performed by gynecologists, who are medical doctors specializing in female reproductive health and have received specific training in performing and interpreting colposcopic examinations. In some healthcare settings, other specially trained healthcare providers, such as nurse practitioners or physician assistants who specialize in women's health or gynecology, may also perform colposcopies under appropriate supervision or with established protocols. The key is that the individual performing the procedure has undergone rigorous training in colposcopy techniques, including recognizing the subtle visual cues of normal and abnormal tissue, and is proficient in performing cervical biopsies if necessary. This expertise is crucial for ensuring an accurate examination and appropriate patient management. Where is a colposcopy done? You'll usually have this done in a familiar setting. Where is a colposcopy done? A colposcopy is almost always performed in an outpatient setting, meaning you don't need to be admitted to a hospital. Most commonly, it takes place in your gynecologist's office or a women's health clinic. The examination room will be private and equipped with an examination table, similar to the one used for a pap smear and, of course, the colposcope itself. The environment is designed to be as comfortable and professional as possible. Because it's an outpatient procedure, you can typically go home shortly after the examination is completed. The setting is intended to provide a balance of medical efficiency with patient comfort and privacy, given the nature of the examination. When might you need a colposcopy? There are specific triggers for recommending this exam. When might you need a colposcopy? Your healthcare provider will recommend a colposcopy based on certain findings or test results. The most common trigger is an abnormal pap test result. Pap smear results can show various levels of cellular changes, such as ascus, atypical squamous cells of undetermined significance, LSL, low-grade squamous intraepithelial lesion, or HSL, high-grade squamous intraepithelial lesion, all of which usually warrant a closer look with colposcopy. Another major reason is a positive test for high-risk types of HPV, even if the pap smear is normal, as these HPV types are strongly linked to cervical cancer development. Additionally, if during a routine pelvic exam, your doctor visually identifies a suspicious area on your cervix, vagina, or vulva, like a visible lesion, an area of abnormal coloration, or unexplained bleeding, they may recommend a colposcopy to investigate further. It serves as a crucial next step in clarifying uncertain findings and guiding further management. Preparing for your colposcopy, important steps to take. A little preparation can make the experience smoother. Let's talk about preparing for your colposcopy, important steps to take. Your doctor's office will usually provide you with specific instructions, but some general guidelines apply. It's best to schedule your colposcopy for a time when you are not having your menstrual period, as heavy bleeding can make it difficult to see the cervix clearly. For about 24 to 48 hours before your appointment, you should typically avoid douching, using tampons, using any vaginal medications or creams, and avoid sexual intercourse. These activities can potentially irritate the cervix or wash away cells, which might interfere with the examination. You might consider taking an over-the-counter pain reliever like ibuprofen about an hour before your appointment if you're concerned about discomfort, especially if a biopsy is anticipated, but discuss this with your doctor first. Wear comfortable clothing and don't hesitate to ask your provider any questions you have beforehand to ease any anxiety. The biopsy step, understanding why and how it's done during colposcopy. Often, a small tissue sample is needed. Let's discuss the biopsy step, understanding why and how it's done during colposcopy. If your doctor sees any suspicious or abnormal-looking areas on your cervix during the colposcopic examination, they will likely take a biopsy. This involves removing one or more very small pieces of tissue from the surface of the cervix using tiny biopsy forceps. While the thought of a biopsy can be unsettling, it's a critical step for obtaining a definitive diagnosis. The tissue samples are sent to a laboratory where a pathologist examines them under a microscope to determine the nature and severity of any cell changes. During the biopsy, you might feel a brief pinch or a cramping sensation, similar to menstrual cramps. If a biopsy is taken from higher up in the cervical canal, an endocervical curettage or ECC, you might experience more cramping. Your doctor will talk you through this, and the discomfort is usually short-lived. This diagnostic information from the biopsy is essential for planning any necessary follow-up or treatment. After your colposcopy, what to expect and understanding results. Knowing what happens next is important. So, after your colposcopy, what to expect and understanding results. If you didn't have a biopsy, you'll likely feel fine to resume normal activities immediately. If a biopsy was taken, you might experience some mild cramping for a short while. It's also common to have some vaginal spotting or a dark-colored vaginal discharge for a few days, especially if Lugol's iodine solution was used. It can cause a coffee ground-like discharge, or if a solution was applied to stop bleeding at the biopsy site. Your doctor will likely advise you to avoid tampons, douching, and sexual intercourse for a few days to a week to allow the cervix to heal. The biopsy results usually take about 1 to 2 weeks to come back. Your doctor will contact you to discuss these results. They might indicate normal tissue, mild CIN1, moderate CIN2, or severe CIN3, precancerous changes, or, rarely, cancer. Based on these results, your doctor will explain the findings and discuss any necessary follow-up plans or treatment options with you. Clear communication is key at this stage. A colposcopy, while sometimes a source of anxiety, is an incredibly valuable procedure in the proactive management of cervical health and the prevention of cervical cancer. Understanding the what, why, and how can hopefully make the experience less daunting. Remember, this examination allows for early detection of potential problems, which means treatments can be simpler and more effective. Thank you for joining me on Life of Medical for this important discussion. If this video has helped clarify what a colposcopy involves, please give it a thumbs up, subscribe for more medical insights, and hit that notification bell. Please share your supportive thoughts or respectful questions in the comments below. And most importantly, attend your recommended screenings and follow-up appointments, and always communicate openly with your healthcare provider. Your health is worth it. Stay informed and take care.